address existing audit observations. There was a focus on the purposeful reporting, as you know now, the reports are completely public, as well as the drive for the technical changes that came from existing practices of country office. We did an analysis of what was useful and what was not, and therefore the portal has been now updated to the current practices of country offices. This slide, many of you should be familiar with by now, but just as a refresher, this is the layout of the 7 program outcomes of the strategic plan. As you can see, the 6 gray boxes subsequently under each of the outcomes are the output areas. We'll just go through them one at a time. The top 3, demand, supply, and enabling environment, are linked to the Morris system. Following that, we have humanitarian action. We have human rights and gender equality, and we have the GRP, which is a global regional program, which is UNICEF's input into the public global good. Just as a refresher, all 6 output areas are now cross-cutting against all of the outcome areas. These are all the program outcome areas that are listed here. We also have development effectiveness, which is outcome 8. We have management, and we have DE, which is, development effectiveness management, as well as special purpose, which is our work for UN coordination. Finally, just to briefly go over what's new this year, you're going to be seeing a new request for information on equity. There's a section called the Equity Case Study. This is a request for country offices to show how the focus of equity in their programming has helped them address those that are most disadvantaged, and how this has actually assisted in results for the country program over the last few years when UNICEF has enhanced its equity focus. The next is an external relations and public advocacy tool that you'll see. We're asking country offices to put emphasis on the public advocacy element. This is now very strongly strained throughout the strategic plan, and public advocacy is now listed as a strategic implementation strategy. The next is security. There is a new box on security that requests information not only at staff and security of premises, but also how enhanced security has helped in delivering of programs in areas where previously UNICEF or its implementing partners may not have had access. So, of course, this is more relevant to those that are in an L3 emergency, but we're asking country offices to elaborate on this, as it's also now a focus on the new SP. The next is the benchmark section. The global benchmarks, as you may remember previously in the old system, you were asked to rate yourself against meeting the global benchmarks. What we've now done is change the format of that, so there will be questions on the performance of the office related to global benchmarks. There's a new section on effective leadership. This section is now trumping the old section, which was the governance structure as well as risk management and mitigation. It's now believed, obviously, that risk mitigation and management is an element of effective leadership, and therefore will be covered under this box. And finally, the newest feature is we have optional reporting on all of the implementation strategies, and this is put into effect to really allow country offices the freedom to report on what they are actually doing, as opposed to just filling in what they're supposed to do in line with the SP as well as other guiding documents. So we're really asking country offices to focus on what took place in line with your results in the reporting year only. Therefore, for high and middle income countries, if you're not utilizing all of the 7 implementation strategies, please feel free to only elaborate on those that you're actually utilizing within the reporting year. I'm happy to answer questions on this entire process at the end of the webinar, but please feel free to add questions into the chat box as the call goes along, so we can address them as they come up. And with that, I'll pass on to Sophie.
Yeah, thank you. So, so this is the one. No, this the voice is good. Okay.
And good morning, good afternoon, good evening, and thank you everyone for joining. And in particular, Yasmin, for giving the overview on the entire core process. This PowerPoint is going to explain in more detail 2 of the 4 budget-related indicators in the strategic plan. Now, there are 4 budget or public spending related indicators, but 2 of these are captured under social inclusion, and they're the 2 I'm going to be focusing on. Now, the first one on this slide is P7.4, countries in which social spending on a per capita basis is being maintained or increasing. Now, that's an outcome indicator, and the good news for all of you is that the data analysis will predominantly be done in headquarters based on UNESCO and WHO databases. However, in some cases, country offices may need to verify the data, so we're going to run over how you do that. Now, P7.4 tracks actual expenditure. That is what the government really spent. This will become an important key point later. The second indicator we're going to discuss under the social inclusion outcome area is P7C1. Now, that's countries with policy and or budgetary frameworks that explicitly address child poverty and disparity. This is an output indicator, and the country officers have the responsibility to assess their country's budget framework and annual budget with respect to the 7 UNICEF outcome areas. They were the 7 across the top of the matrix that Yasmin just presented, which you'll all be very well aware of. It's important to know and consider that 7C1 tracks budget commitments. It doesn't track the actual expenditure. So that's the difference. That's a key difference, other than the fact that 7C1 is the responsibility of the country office. Now, the data for 7C1 will be collected by the SMQs, but if and only if social inclusion has been coded in. Now, this is a key factor, which if you have any further questions on that, Yasmin, I'm sure, can explain much better than I can. Right, so this is what it looks like if you go to the ICON site and you look at the indicators. The first one is 7.4. You'll recall 7.4 is going to be mainly done in headquarters, but exceptionally, you may have to complete this. 7C1 is where your responsibility lies. So that's what the actual indicator is, and this is what the SMQ is. And you can find all of those worksheets on ICON. Right, so we're going to start with 7C1 while I have your attention, because this is where you have to actually do the work. So why on earth is this important? Now, for many people, in particular non-budget people, and I'm a budget person, budgets seem quite esoteric and not so important. But in order for the UNICEF mission and the milestones to be achieved, you really need the policies to be implemented. But for policies to be implemented, you need these measures included in both the budget framework and the annual budget. So we're talking about 2 distinct things here, the budget framework and the annual budget. Now, the budget framework for most people is actually the planning documents. It's your PRSP, it's your national plan, your 5-year plan, your 1-year plan. It's a big document. You can find it in Word or PDF. The annual budget is the much scarier thing for most people. It's a big book of numbers. Right. So planning documents, however, may not always actually lead to an actual improvement in the budget. You can have a beautiful planning document, an amazing PRSP which says how much the world will be improved, and you can have nothing in the annual budget. You could, in some very unusual cases, have annual budgets increasing, but a planning document that doesn't actually address child poverty. So you might consider, a heavy oil exporter, their budget's increasing, they've got a lot of money, but they don't really have policies or budget frameworks that actually address child poverty and child disparity. So it's really important that both documents and budgets are monitored. Okay, so this indicator, 7C1, we're tracking effectively your success in removing budget-related bottlenecks. But it's also important because you're going to need this to help you build and achieve your milestones. So, speeding up, 7C1, it's part of the SMQs. You are going to provide a combined score. You will score the planning and budgetary framework and the annual budget. Each has a score between 1 and 4, and you'll add those together. It's nice, it's simple, we can all add between 2 and 8. Right, so what are the 4 different ways we would score this? And again, this is all posted on Icon in clear guidance and clear details. The top score is if the budget allocation, as referred to in the planning document and the budget, increases or maintained in 7 UNICEF outcome areas. So that means all the outcomes, you're seeing something really positive in the documents, and you're seeing actual real improvements in the numbers. Score 3 is the same measure, but for at least 4 outcome areas. Score 2, 2 outcome areas. And a score 1, no one gets 0 in this game, if it's not mentioned at all in the document, or if it's in 1 outcome area. Now, if we think about this, we'd expect to see most of the planning and budgetary frameworks will often have higher scores than the budget, because most governments write nice, positive, glowing, happy frameworks. However, this may not be, this may not lead to actual improvements in the budget. So, we're going to talk about the frameworks. We've got our national planning documents, which are your PRSP, your 5-year plan, your 1-year plan, your MTEF, your medium-term expenditure framework. The question to be asking is, do these address child poverty? And so are your 7 outcome areas, covered? In particular, does the document actually say that the government intends to increase allocations in these areas? And what you have to do, quite simply, is count those areas, and there's your score. If all of the 7 outcome areas listed here, but you'll know them well, then you give that country a score of 4. If it's less than 7, you apply the table that you saw on the slide before, which is also in the guidance. Right, the annual budget's a bit trickier. The annual budget, you'd think it would be easier because you're just going to look at the numbers. But the question is, where are we going to find this? And so, first of all, the easiest thing is every year when the treasurer in a country announces and publishes the budget, you're going to see a published budget statement as well as the big fat book with numbers. So the quickest thing and simplest thing for most of you will be to look at this published budget statement and to see if the government has highlighted, because governments always like to show when they're doing something good, highlighted that they're going to spend more money on education or more money on HIV. Now, how would you measure social inclusion? Think of it in your own country office terms, but most likely, is the social protection or food programs, cash transfers, will they be expanded? So if we quickly recap, the first score we're going to have is for our planning and budget frameworks between 1 and 4. You're going to look at the big, heavy Word documents that governments produce. The second one is the budget. Now, the easiest way will be to look at the budget statement or the budget summary. The budget summary is the front page normally of the annual budget produced by the government. Now, that will be, to make your life easier, most governments normally have a table with this year's budget and the previous. So you can just look whether or not that number increased for the 7 different outcome areas. And again, you'll score it. If all 7 outcome areas increased or were maintained, it would be a score of 4. But we know that in most cases that doesn't happen. And in some cases, the government simply doesn't address the outcome area in the budget. So what's important here is that you need to assess this in real terms. Real terms means that your $100 this year is in a similar value as your $100 last year. We're going to come to that. Most budget statements will actually be set in real terms, but imagine you're in a country with very high inflation and the budget for 1 year for education is 100,000 and then the next year it's 10 million. Maybe 10 million this year, for example, in Zimbabwe when they had hyperinflation, is actually less than 100,000 last year. Right, so we've just run through where we can find the annual budget data. The best way will probably be the budget statement because it's going to announce the areas where the spending has increased. You know, the question you're asking is, did the government promise to spend more or the same amount in these 7 outcome areas? So there'll be an impact on child poverty. The other way is to actually open the big budget document and look for the front tables, which will have the comparison. And then once again, you can pull it out. Did the health budget increase? Did the education budget increase? Of course, your colleagues will often know this in their specific outcome areas. Right, so that was 7C1. Now what we were tracking was what the government has promised to do. So that's the allocation. 7.4, which again is going to be predominantly collected in headquarters, is what the government really spent. And often the governments are like us. They promise to do things and then they don't do them. And there can be reasons because there's a recession or civil instability, or it can be that they just don't deliver on their promises. So, why is P74 important? Basically, P74 looks at how much is spent in per person terms. And what we want to see that is the same or greater than the previous year. So is the government spending more per child this year on education or health or water and sanitation than it actually spent last year? Now every country's ratio and amount for this will be different, but the change is what's important. So if the amount spent this year per child or per person is less than the previous year, you could argue that possibly these sectors are not government priorities. Of course, there can be other reasons, as I said before, why governments may not be spending more or less. They could have economic downturn, which decreases the entire size of the budget. And so what's important to know about this is in P7C1, all 7 indicators are being captured by the staff in the country office. For 7.4, headquarters is going to use health and education as what we refer to as proxy indicators. That's because it's easy cross-country analysis and comparison, and we can get the data quite nicely and cleanly from UNESCO and WHO. Right, so as I said, this will be done, as in the data will be collected and analyzed in consultation with the education and health sections by the PF4C team in headquarters. So the data from UNESCO on education and WHO on spending, it's comparable across countries. It's consistent. The education section are using a similar indicator. Now you'll recall I said I was going to discuss 2 of the 4 budget-related indicators. So we want to make sure these 2 indicators are actually collecting the same information with the same foundation and baselines as the others, which is education is one of that. And the WHO indicator uses the Global Health Expenditure Database. You can access these yourselves if you want to see how we're going to do it. And it's very clear. Of course, if you disagree with the WHO data or the UNESCO data, you can, of course, provide data yourself. That would be extra work for you and maybe a fun exercise if you like looking at numbers. However, if there are problems with either of the 2 databases, that is the country, for example, is missing or too outdated, we're going to rely on the country office to actually collect data in these 2 areas. So these 2 areas for 7.4 are just health and education. And to make your life easier, we'd be looking at the total government expenditure. We're only looking at what the government spend. Right, so this is going to be a bit of maths, but we've made it as friendly as possible. So we're looking at the actual government spending in real and population adjusted terms. Real means we're adjusting for inflation, that we can compare this year to last year. In economics and in the tables on the WHO and UNESCO, that's referred to as constant prices. Now, the real value of total government expenditure, it says total there, but we're looking to make it easier, it's government expenditure on health and education. And so if you see the red box with the formula, it says total expenditure is general government plus private expenditure. So we're capturing that general government. We don't want to capture what people are paying out of pocket, even though that can be very high. The reason we're doing this is we want to monitor how much governments are actually spending on these key areas for UNICEF outcomes. How much buy-in and actual action do we see from governments in helping address child poverty? And this is important for the country office to meet the milestones and improve in their general outcome areas. So general government expenditure is a fancy term which basically just means all government agencies and departments at all levels. So all you need to think about is the total government expenditure. Right, so this is a screenshot from what the WHO database looks like, and I've chosen 3 countries near the top of the list, and anyone can download this anytime. Now, the font's a bit small, but as you can see, when you pull the data from the WHO database, you get total expenditure, then you get general government, and then you get private expenditure. Now, what we want is people to record the government expenditure. So this is not the total, again from the formula on the page before. And if you look at Benin, and why this is important is often people will refer to total expenditure, but they'll forget that there's private sector. It's what, that you and I may have out of pocket, but it could also be private sector investment. And so then what you're going to need to do, however, is that's the total amount. It's not on a per capita basis. Per capita is making sure we're looking at how much is spent per student or per person. So what we need to do is divide that government expenditure by the population. Now, in headquarters, we will be dividing by the total population because the data that we have from those 2 indicators is for the total population. So population data, however, if you need to do it yourself, you can find from national statistics, the UNFPA, so that's what that table is from. Or if you want it by age group, for example, say you wanted to divide the education spending by the total number of students or children ages 0 to 19, you can find that in the UNDESA Population Prospects database. They're all very easy to use and very easy to download. What is important to remember is that if you have to do this, you need to look at whether the amount spent per person or per student increased. Now, you're going to have 2 different years there, and the population will change. So you're going to need to divide the different spending by the relevant populations. Right. So, what if I have data from the WHO or UNESCO and it's out of date? Right, well, I've just explained to you what you're going to have to do, but don't worry, we're here to help, and so are your social protection colleagues. It's actually very easy, it just sounds a bit scary. So the first thing you're going to need is data on government expenditure and health. You get the data on expenditure from the Ministry of Finance, or you can get it from the line ministries, your health ministry or your education ministry. Remember, we're looking at what they actually spent, not what they promised to spend. The next thing we need to do is remember that we need to adjust for inflation. So if we don't have it in real terms, we need to get the CPI, Consumer Price Index data, and divide the number by that. Sorry, I meant your SP colleagues, your social policy colleagues, not your social protection colleagues. I'm sure your social protection colleagues will also help you, but, anyway, we're all here to help is the message. Now, you take your total expenditure, you divide it by the CPI, and then you also need to divide by the population. This is really very easy for you to do. It just sounds a lot more complicated. Right, so this is what the guidance will look like. So as I said, not only do you have, people from the PF4C team, me and my colleagues, you also have your social policy colleagues. But just in case you want a maths refresher, it's also published in the guidance. So what is key to remember as we go into the question session is that we have two indicators under social inclusion. One is P7.4. That's mainly going to be done at headquarters. However, in some exceptional cases, you may need to collect data for that, right? And that will involve a bit of maths. 7C1 is the area where you're actually going to have to do the work, and that's where you will address the 7 outcome areas in both the budget framework documents and also the annual budget. So you're going to be looking at the PRSPs, the annual plans, and the budget statement. And then you're going to see how many outcomes of 7, give the country a score of 1 to 4 for each, and then add it up to 8. And with that, I'd like to thank you for your attention. I hope it hasn't been confusing or boring, and you actually can see that this could be important to help you. Not only is it important as an indicator, something that needs to be done for the core process, but actually knowing this helps you understand the extent to which government prioritize these areas. And with that, I will open the floor for questions to be managed and mediated by Nima. Thank you.
Thank you, Sophie. If anyone have any questions, you can write it in the box here, or I can activate your microphone to give your statement.
Okay.
Okay.
Go. Would you like to speak or would you like to type?
No, just let them type. No. Just let them type.
Just
that me?
Where is
Who were we looking for?
she?
It's not clear who that is. Yeah.
No, we can't
Oh.
hear you. We're just de-micing you.
No, they're
Oh,
not
that's
on
okay.
the. They're not in the call.
It's here.
It's a guest.
No.
Hello.
Hi,
Yeah.
we can just hear you. If you could speak up a bit loudly.
Hey, can you hear me now?
Perfect.
Excellent. Thank you so much. I really enjoyed it, and I'll try to just be very brief and maybe just ask a few thoughts. It's mainly related to sort of like the perception of the budget numbers and the realities around these numbers. Because as we sort of briefly already sort of dialogue over email, I think that budget allocations are not a very reliable proxy for as a reflection of government's commitment to any particular areas of investment. And I'll give you just a very quick example. Having worked in ministries of finance for several years, the week before the budget is always the time when the budget has been done, and then everybody starts asking questions to make sure that all the donor requests are being addressed. And this is especially the case in countries where ODA plays an important part. So what tends to happen is a common complaint is that the military budget is too high and the health budget is too low. So what very clever people in the Ministry of Finance do is they create a budget line under the Ministry of Health that is called HIV/AIDS support to police and military personnel. And a good chunk of the military budget goes under the health budget. It remains military budget, but the numbers show dramatic increases in the health budget. And so when we do our calculations, we see that the health budget is very high and we give a lot of credit to, government for that particular objective. So just just a word of caution, I guess, as to how seriously we take some of these numbers. And another sort of related issue is really on taking budget to the next level, is to the degree to which these budgets are linked to the plans and to the degree of our ability to score those budgets and planning frameworks. Because plans, you said it in your presentations, they're a beautiful depiction of the world. But the problem with plans is not so much that government doesn't budget for key priority areas laid out in the plans, but for some key priority areas laid out in the plans simply cannot be budgeted for according to 95% of budget structures in many of the countries we work in. And a perfect example is something like early childhood development. Being such a broad concept that brings in education, health, social protection, early cognitive development, but ultimately, because of the voting structure of many of the treasuries, the only thing that treasuries can do is give early childhood development funds to ministries of education, and early childhood development becomes this tiny little box that only deals with pre-primary schooling. So even in our attempts to then score the validity of the planning versus the budgeting framework, then it becomes a very subjective exercise. It's up to me in Uganda to figure out how much I like these plans and this budget, but then it would be someone else's perception of their plans and budget in Rwanda and so on and so forth. So even when we compare these scores, are we comparing the same or are we comparing different perceptions? Sorry if I spoke for too long. I was just to squeeze in a lot of information in.
Okay, thank you. I think on that one, we're just going to, it mainly will be, okay, I'm going to answer 3 questions here quickly. First of all, Min, there is no SMQ for 7.4. The SMQ is for 7C1, right? The 7.4 is the WHO UNESCO data. And the most important thing to remember is you're only going to see the SMQ for 7C1 if you've coded social inclusion, right? So I can't explain on the coding process, but if you need more help in that...
I'll just explain it now.
Yeah, Yasmin can explain.
Okay. Thanks, colleagues. Let's just first go over what the SMQs, the strategic monitoring questions, are. So you have your set of indicators that are in the strategic plan, and the total indicators in the strategic plan cover all outcome and output areas. Within those indicators, the sources of data vary quite considerably. So you will have some pieces of data that are coming from global sources, as we've noted, UNESCO, WHO, etc. And then you have some sources that are, of course, UNICEF, which are country offices. Those are what are now previously known as Annex A in the core. That's now known as the SMQ tab, or Strategic Monitoring Questions tab in the RAM. Those questions will gather pieces of data that will answer certain indicators within the strategic plan, not all of them. So as Sophie presented too, one of those indicators will not be gathered from the core process, so they won't be present in the SMQ. Everything you see on the SMQ template are only the questions that we are gathering from country offices. Headquarters will take data from other global sources to fulfill the requirement of reporting to the board. That's the first thing. The second thing is, for PIDB coding in the system, country offices are required to code all outcome, outputs, and activities at the country level. I'm sure many of you are familiar with this. If your activities have not been coded properly, and if your outcomes or outputs do not check at least the outcome area of social inclusion, which is outcome 7, in the system, in Vision, you will not be able to answer the questions on social inclusion when it comes time to reporting. Your PME focal point or your planning person in the office has received additional guidance from the regional office on this. So if you have any questions, you should please address them as soon as possible. But for the social inclusion questions to pop up in the system, the SMQs to pop up in the system in the RAM, you have had to have chosen social inclusion outcome 7 for at least one of your elements of coding.
Thank you.
Okay, so if anyone has any further queries on that, you're to contact
Email them.
either someone in Yasmin by email or your regional office planning person. Okay, so very quickly, Priya, you're totally right. Budget allocation does differ from real spending. So that's why 7.4 will capture the actual spending and 7C1 the allocation. Now there's a couple of reasons why allocation is done for 7C1. First of all, now Usman, something to think about here is what we're trying to collect is not child spending. We're looking at the spending by sectors. So I'm fully aware that calculating or estimating the exact amount spent on children is important, but we're trying to use our judgment in has the education budget increased? And this will give us an idea of the commitment, although, as Diego pointed out, sometimes it's very difficult. So budget nomenclature, that, for those of you who aren't budget people, basically most budgets are done by ministry or by sector under function and subfunction. So, sorry, I just can't read the rest of your question. Okay. Super. Sorry. Okay, right. And so what we're looking at is these 7 areas, and for you to make your judgment on whether those areas, as you know it, in your country are addressed in the allocation. Allocation, again, is different to the actual outturn. The outturns can be incredibly different for good reasons and for bad reasons. The good reasons can be that the government simply, couldn't spend the money it wanted to, for political instability, or they ran out of oil, or they had an exchange rate issue, and it was, but they're the bad reasons where the government says they'll do a lot of these things and actually doesn't deliver with it. So for those of you who are having this issue between allocation and outturn, 7.4 is looking at your outturns. 7C1 is looking at your allocation and your planning document. So we're capturing basically these 3 phases. Now in 7C1, if you'd actually like to capture the budget revisions, that would be fantastic. However, the core process, of course, has a delicate timeline around it. We all know that actual outturn data often has a lag. In some areas, in subnational terms, that can be 1 to 2 years. And so, that's quite complicated. Okay, so in both cases, budget in most of... Right, so exactly. Now, Ruth, that's a very good point again between capital investment and current investment. Again, if you want to do the hard work and, disaggregate this, that you're more than welcome to. Because remember, 7C1 is actually a qualitative score. You're going to score the 7 indicators from 1 to 4 and then add them up. So we're not asking you to actually do the budget analysis. I would love it if you did, and if you did and wanted to send it to the PF4C team or share it on the PF4C COP community of practice, everyone would think that that was fantastic. But remember, these are internal indicators for M&E purposes. We're not expecting country officers to do budget analysis. Again, I'm going to encourage you to do it, but we're not asking for the numbers for 7C1. We're asking you to say, did the allocation in the 7 UNICEF outcome areas increase or was it maintained? If you know, for example, in RDC, that possibly operating expenditures decreased, whereas capital investment increased, you can score it that it didn't increase if you want. We're not going to check your maths on this. So that is, again, so I think we've got 3 or 4 main points here. 7.4 doesn't have an SMQ. 7C1 has an SMQ. It has 2 variables in the SMQ which you will score from 1 to 4. You will only be able to see this, as Yasmin explained, if and only if social inclusion has been coded in. Now the next point is 7.4, for those of us who are used to budgets, is our outturns. 7C1 is our allocation. So we're capturing the different phases of spending, from the framework where the governments write their dreams, to the annual planning, the annual budget, which is when the treasurer will actually figure out the composition of what he's going to spend for the next year, and then 7.4, what they really spent. So have we got any more confusion on these 2 indicators? Right. Any more questions?
Yeah.
We have another 11 minutes for interesting stories or comments or concerns.
Regrets.
Regrets, yes, okay. Well, we're trying to... no regrets. And unfortunately, the core process has gone ahead, so unfortunately, this is what is set in stone. But remember, the good thing is 7.4 is going to be pulled from UNESCO and the WHO databases. 99% of the time, that will be done in headquarters. If, of course, you'd like to do that, we'd love you to ask another question, Diego.
Thank you. Just a little question, sort of like to tickle our brain, really, because a lot of the social spending debate in some countries centers around public sector reform, especially in terms of the hiring of teachers, the hiring of nurses, midwives, and so on and so forth. Bottlenecks in public sector reform essentially undermine a lot of the work that the health sector, the education sector can actually deliver on. So I'm just wondering if there is any sort of dimension of this work that can sort of be stretched to include some of these aspects of policy that seem very unrelated to our work, but in practical terms, they're very, very pertinent.
Thank you, Diego. This is Jing Cheng, UNICEF HQ. These are really good points you raised. Perhaps Yasmin has made this point earlier. These 2 indicators on budget and public spending and social inclusion outcome areas should not be seen in isolation with the rest of the strategic plan. Some of the sector level reform work associated with improving reforming related to civil servants, teachers, etc., strengthening of the health systems, education system at the local level, etc., are intimately related to these indicators. In other words, these 2 indicators capture the aspect having to do with the utilization and allocation of public financial resources. But it's just one of the many inputs in order to produce good outcomes for children. So I encourage, and along the lines of the many good points raised here, I encourage our colleagues in the field when reporting on these indicators and think about some of these important questions. Really, the ultimate purpose of these exercises is to help inform UNICEF programming while making it possible for us to track our progress and contribution at the global level. Thank you.
And just to add to what Jin Qing said, I think you've raised a very important point, Diego, that while these are indicators that you and we in the PF4C team have to complete as part of the core process, Diego has mentioned how looking at these can actually help us understand better why there are bottlenecks in these different outcome areas. Why, for example, isn't education improving as it should? Why, for example, isn't health improving as it should? And again, in your qualitative assessment of the different 7 outcome areas under 7C1, if you'd like to go into more depth of understanding these areas and possibly why you're not seeing budgets increasing or being maintained, or maybe you're seeing the budget increasing, but it's actually not transferring into better outcomes. Maybe that involves a bit more digging and actual, budget analysis. So I think, it's important to see budgets as a way to track and monitor what the governments are doing, and these key entry points for UNICEF country officers to stand up and say, well, thank you, Minister for Education, but, we're not actually seeing the money transfer into better outcomes. It helps you ask better questions. And so again, thank you all, and thank you, Diego, for your very fine and, important points. Actually relating the indicators to operational work. Again, the PF4C team are here to help, as are your social policy colleagues. And if you have any more questions about how you might want to assess these outcome areas, go ahead. And we will be posting the recorded presentations onto the COP site. And for those of you who aren't members of the I don't know what the COP is actually called officially, the PF4C COP, Nima would love to have you join. And it's like how many people can we get? We're trying to win the COP, tracking numbers. And yes, the other thing is yesterday we posted announcements on the COP site, as well as webinars and resource materials. There is a question section. So if you have any further questions, for example, Usman, you're going to look in detail and come back to us, please post your question in the discussion area on the COP. And someone from the PF4C team will respond. If you have questions that we need to direct to Yasmin or DRP, we will do so. Right, so Christelle, you have a fantastic question. If you already know that the WHO doesn't have the data on Zimbabwe, we can have a look at that and we can help you estimate how that will work. So here we've got one of these exceptional cases. Thank you for bringing that to our attention, Crystal. You will unfortunately be heavily involved in 7.4 as well as 7C1. Now, the final thing is yesterday we also announced on the COP that on the 16th, there is a World Bank BBL on service delivery and silos. So that's the fact that people work in education or health or social protection, and they don't look at the budget overall, so we don't get this macro view. You can join that BBL via joining the World Bank Service Delivery Community of Practice. But we'd really like you to join our Community of Practice first.
Hello, everyone. This is Ching again. Just wanted to mention one thing that that has not been mentioned so far, which is that if you go through the strategic plan indicator matrix, you will notice that in 4 sectors that there's no public spending, budget advocacy type of work-related indicators. So the question is, if you in a country office have worked intensively on budget analysis, budget advocacy in order to increase budget allocation in the health sector, where would that activity be captured? After all, how does UNICEF contribution in this area can be captured, and how this will move the indicator? If that kind of question comes along, it may be useful for you to know that the coding is flexible enough. The system is flexible enough to allow you to code it using social inclusion outcome indicators, SIC codes. This is a specific intervention code. And any more question about specific coding exercise in RAM or Vision, you can contact DPR resource people as well as the group in as well as team FNC in DPR. So this is sort of just say additional resource available for that particular aspect of the reporting as well. Thank you.
Yeah. So thank you everyone for participating in today's webinar session, and thanks again to Yasmin for presenting, and Sufi as well. And if there is no any question, we should conclude the session now. Thank you.
Thank you.
Bye.
Stop the